evening once again, and welcome to another Doctor on Call program. It is a pleasure as always. Of course, every Tuesday evening at this time, we bring you this program, of course, sharing information that can help you to better take care of yourselves and to improve your wellness. This evening, we have with us no stranger to the program, of course, Dr. Bert Brathwaite. He's been here before, of course, like everyone else, sharing information, and assisting in whatever way. The month of February, as we said last week and the week before, it's Cancer Awareness Month. And so for that period, we will be looking at cancer. Of course, it is one of the conditions that has created, if I should say, fear among a lot of us. Whenever we hear of cancer, we tend to get a little frightened. But and I'm sure Dr. Brathwaite will agree that there are some of them that can actually be cured, or they can be treated in such a manner that can cause you to live a normal life. And of course, we will look at some of them this evening. But we want to focus this evening a lot on some of the common cancers that affect men. Next week we will look at some of those that affect women. All right. Of course, there are cancers that affect both gender, male and female. But we'll spend some time this evening looking at those that are common among men. So it's a good time to welcome Dr. Brathwaite. Dr. Brath, good evening and welcome to Doctor on Call. It's been a while.
Thank you very much. That's correct. That's correct. And a good evening to the listeners and viewers.
Yes, indeed. So, Cancer Awareness Month. We want to focus a bit. I know your area of specialty has to do with the abdomen and these areas down there. Gastrointestinal. Yes, indeed. So, we're gonna talk a bit about that. And of course, a little later in the program, we are going to open the telephone lines so our callers can, call if they have questions. We'll accommodate you and whatever contributions that you have to make. So, Doc, let's start. Cancer. It is Cancer Awareness Month. Let's just briefly remind folks, when we speak of cancer, what are we talking about?
You're talking about an abnormal proliferation or multiplication of cells. So these cells become abnormal, and they grow in size and number, and eventually they can take on characteristics that allow them these cells to move into other tissues, either surrounding tissues or even distant tissues, what is known as metastasis. And that's basically what cancer is. And of course, there are some specific agents and factors that tend to make the cells go abnormal. Some we can control, others we can't control. Right? It could be hereditary or genetic influences in some cancers, and one can do nothing really about those other than to be aware of them. And in some instances, some folk in the so-called developed countries, they will go, and if you have a very strong propensity, let's say, to breast cancer, and you have the strong gene line, they say, well, look, if I remove the breast, I can't get breast cancer. Right. And that happens. Yeah, maybe we don't probably practice it to that extent because we don't do genetic testing to that extent. To be, of course, people can avail themselves of these services more readily now because tissues and samples can be sent overseas, etc. Right. And those analyses made, but of course at a cost. Right. Unfortunately.
Right. But it's interesting because you said that there are cells that they become abnormal and all of that. But of course, the human body is made up of cells. So why these particular cells? Because of some abnormality, create problems and causes people to die and go through some really difficult periods in their life.
But the cells are always multiplying. And when they multiply, they seek to reproduce themselves accurately. But in multiplication at times, the process will not go, the chromosomal changeover may not go perfectly. You can get deletions, you can get additions, you can get rearrangements. And any of those factors will lead then a line of cells to develop that will proliferate, and those line of cells will be abnormal. So it's like, the engine is running perfectly all the time, but it stutters sometimes, it develops a choke, as it were, and from there on you lay the foundation for further changes down the road, and ultimately, some cancers much more aggressively than others.
But what you see, I'm trying to get at something here. Right, they become abnormal, they multiply and all of that, but why does it get to a stage where people die?
Well, once these are abnormal, you have to imagine quite often the cells, as I told you, the cells are increasing in number.
Yes.
So let's say the gut is constantly turning over its cells, and it replaces it, and you look at it, it looks fresh after a few changes. But if you now get a particular cell in an area, and that starts multiplying over time, multiplies and multiplies at a faster rate than usual, and with abnormal cells, those cells are not going to behave in the normal pattern where they're going to just die and be sloughed off.
Okay.
Those cells will stay there, and more of that type of cell will replace the normal cell. It will invade the normal cell and cause the normal cell to be displaced, as it were. If you look at it from a straight physical point of view, that is putting it at its most elementary.
Right. Yeah. But I do get it, and I think that the point you made there is very instructive. They do not behave as normal cells do. So the normal cells that behave in a manner to maintain life and to keep life ongoing,
right.
These cells, they do not do that.
That's correct. And not finishing, these cells, when they behave like that, in the case of the stomach will be secreting juices, it will be secreting certain enzymes, etc. These cells will not be able to do that, or certainly not do it effectively. But they'll be looking to grow.
Right.
And as they're looking to grow, they're utilizing the body's energy, and lots of the body's energy lines
used up by these,
called the so-called ATP, is going to feed these cells, because it will be growing oftentimes at a very voracious in a very voracious manner, and thereby, as I say, so it's a physical aspect, and then what the function of the cells is not going to be as it should be.
Okay.
And if when they get big enough, they will obstruct organs, they will invade blood vessels, or they do a whole host of things.
Right. They mess up your whole system.
That's right. Yeah.
Right, I understand. Yes. Now, okay, excellent. So let's talk a little bit about, we have lots of different types of cancers. We've heard about them. In women, the breast cancer, which is very common, then there's a cervical cancer, and there's a host of others. In men, the one that comes to mind, first of all, is prostate, which is very, very, very common among men. Let's talk a little bit about this, and because I also want to spend some time on colorectal cancer, which is very common in men as well. But let's start with maybe the one that is most prominent among men, prostate cancer.
Undoubtedly, it's the most common. As a matter of fact, I have some statistics here, if I can find them now. No, lost them for a moment. I look back for it. Prostate cancer, yes, is a major factor, and every man should be aware of the fact that from the time you reach age 40, certainly by age 45, you need to be checking on it annually. You need to have a digital examination and a blood test.
Okay. Mm-hmm.
And between those two factors, if you're doing that on a regular basis, you can pick up any signs of the cancer at an early stage. Then you will go off to a specialist and they will decide what would be the best line of approach. Sometimes they may just observe if they see the enzyme levels, the prostate-specific antigen PSA tests. If they see that creeping up, they may just observe, just do biopsies of the prostate, and they will get back a report saying a certain percentage of the cells are showing abnormalities, showing cancer, etc. And they have definite guidelines that they will use to decide when they would move into either do surgical removal of the prostate, or radio therapy, or you can just get seed implants, with seed implants, so-called brachytherapy. And after that, folk can do pretty well, and may often die from something else. But if the cancer is left there and is picked up when it is spread, for argument's sake, then it is far more difficult. The chances of your longevity is going to be significantly limited then. Unless you're very lucky. I'm not saying that even when it's spread, in some cases people don't do well, but it's going to be much so. So that's why people, folk are often worried about going and finding these things. And I say to them, why are you? No one wants to know that you have cancer, but if you know you can step in from early, and by stepping in early, you are going to give yourself not just a chance. There are lots of people who you'll be surprised in the community who have had cancer. The prostate has been treated, and then we're moving on 5 years, 10 years, 20 years, right? You leave that cancer there for another year or two, and it starts to spread outside the cancer, the prostate gland, and go into tissues, and especially it goes into bones and things like that. A far more difficult proposition to deal with. So it is the other cancers that you can actually, once you see changes, you can go in or you can do things to prevent the cancer from coming on. Like in the cervix, if females are having the regular pap smears, any change of cells before they become cancerous, when they're at a precancerous level, and they're going and they're treated, they don't go on to get the cervical cancer. Another one will be the colon cancer, which we'll talk about, as you said. So it is about having regular medical reviews and acting accordingly. But of course, before that, doing things to limit the chances of cancers developing. Or what are some of the factors? In the case of some cancers, worldwide smoking is still a major factor. I think it's probably less so here than it was, let's say, 20 years ago, right? But what I suspect is probably one of our biggest factors here now is obesity. I don't have statistics on it, but I would hazard a guess now. Of course, we have decreased our cigarette smoking, but we still smoke. There's probably more marijuana smoking than there was 20 years ago. And marijuana has potential carcinogenic agents in it. Not to the extent probably of the cigarette, but it's I tell folk, why you want to inhale something other than the nice fresh air that you can get if you're up on Grand Tank or if you go to Grand Beach, right? That's the air you want to inhale.
Of course, definitely.
That aside, so you want the question of putting yourself in living a healthy lifestyle. That's the number one. That's the first factor. And when folk, we have a problem with overweight, moving into obesity in an increasing percentage of the population. And once you see that is happening, the fat cells produce hormones to produce various chemicals and various agents that cause inflammation in cells. The fat that you see, especially the fat around the abdomen, is not an inactive agent. It is inside those fat cells. There's a lot of activity going on, and that activity will cause these cells to produce various chemicals, and those chemicals will in turn move and cause some cells to become abnormal, behave abnormal through some of the mechanisms that I just mentioned. So the number one thing that people can do to limit the chances of things is to remove themselves from the risk factors for cancers. As we said, smoking, as we said, is probably not as major problem as it used to be. Looking after your health to keep your weight under control. Eating right, eating correct is so critical. Lots of what people are eating today is not the healthiest of stuff.
Right.
You know, people turn up their nose at the best of foods. The best of foods are what we plant here. Right, we are blessed. We can we're not producing them to the extent that we should be producing.
That's
them.
right.
But and of course they have become much more expensive, but a lot of people can still go in their backyard, and some people have breadfruit there and tell you, no, I don't eat breadfruit, yam, potato, that's it. But no, you will go and get some processed food, right? And that is food that is made with a lot of oil, etc.
And sodium too.
That's right. But so it's about, and those process where you go for those types of foods that are processed in that type of setting, those are the foods that are going to make you put on weight.
That's right.
And that weight in turn is what is going to lead you. Like, for instance, in the case of females, especially postmenopausal, the fat cells produce estrogens, and estrogens will give increased risk of breast cancer. Right? So you work towards trying to keep yourself in we have sedentary lifestyles, too sedentary. But you see the cars on the road.
Yes.
People don't walk anymore. That's right. People who would have been walking 2 years or 5 years ago, walking significant distances to get for a bus, you just hop in your car and go to work. But I'm glad for the comfort for the individual, but if you're going to have that comfort, you have to find time, use that extra time when you get home 3/4 hour earlier, park up the car and go for a walk.
Right.
You know, most of the roads you can walk along and walk safely along, go for a swim, do whatever you enjoy, whatever physical activity you enjoy. If you're younger, you want to get into group sports, football, cricket, swimming. It doesn't matter. It doesn't matter the physical activity you do. Once you're doing it on a consistent basis, and once you're eating right, Food and Nutrition Council has done a great job over the years telling us what our plate should look like.
Yes.
That segment there, that big segment of green leafy vegetables, yes. And the fruits. On the mornings, you can take a cup of tea and some fruits, and you can go off to work. You don't have to take anything else, right? Sometimes you will find people getting up, and the first thing they will go and they will take a sandwich with some ham.
Yes.
So, and then the other factor I mentioned, smoking. I mentioned being overweight. Those are two of the major factors that we have to get people to get into.
What about the use of alcohol?
Yes, that's the third thing I was coming to now. Interestingly, I don't know if you remember, just before there was change of government in the United States, the Surgeon General, sometime in January, early in January, came out and said, look, I want to put alcohol as on alcohol bottles, a label, just as you see on cigarette packets, smoking, the cigarettes are dangerous to your health. I want to put that to your on alcohol. Now, I don't know what will be the ultimate outcome, but for us here, as a population that drinks a lot, consumes far too much alcohol, right? We need to be thinking along that line as well, and that you put a label there, and more than they're saying now that even more than one drink a day could be potentially hazardous. Because as I tell people, I take a drink myself.
Right.
But I tell people, I know it's basically toxic. It's just part of my socialization. Right now, and many people's socialization. But it is not. It is basic. Alcohol is basically a toxin. Right? And it will cause inflammation. Often, if you're just drinking a drink, it's not going to cause you any gross upset. But when it gets into the body, it's still going to be causing some cellular damage at some level, probably in the GI tract. And as you know, for argument's sake, in the stomach, it can cause inflammation in the stomach. When you go in the stomach, you can see it all eroded and red, and you can bleed. You can bleed from
internal,
alcohol. From the stomach. It can affect other parts of the intestines, affect the liver, as we all know, is leading to cirrhosis.
Fatty liver,
and fatty liver first, and then on to cirrhosis. Pancreas with inflammation, esophagus, and many organs.
And all of these organs you mentioned, they can become cancerous.
I mean, you get all these. Most of these things I mentioned to you will cause cancers, especially in the oropharynx. Alcohol can, and the esophagus it can. We mentioned the pancreas and liver, and being overweight can affect. The GI tract as well. It can affect the kidney, the liver, the endometrium of the uterus, the pancreas, and many organs can be affected by any of these factors that we have just been discussing.
Just to go back on the prostate, there are times I believe people confuse prostate cancer with an enlarged prostate. Can you just speak a little of that quickly?
Yeah. Well, as men reach age 45 a day around, the prostate starts enlarging. And in enlarging it narrows the urethra which passes through it. The prostatic urethra. Puts pressure on it, right? And your whole urinary pattern can change. You'll find yourself sometimes wanting to go off to the washroom more often. Sometimes when you get to the washroom, you may drip and not get have a good stream. You may get it more often at night, so you get a number of factors. Now, all of this, it could be in a setting of what is called benign prostatic hypertrophy, BPH. And as it says, it's benign. It's annoying, it's troublesome. But there are medications that you can use to control that process. And oftentimes people may not have to have anything done to them. If it gets too bad, the surgeons can go in and they can actually core part of the prostate, and your urinary flow can come back pretty much to normal. So that's benign prostatic hypertrophy. If you develop symptoms like that, don't think necessarily that you have cancer, but you should still be going to check. And one of the things the doctor will do is obviously do your PSA level. He will examine you digitally, and a lot of people are afraid of a digital examination. I know it's not something that's pleasant, but it's something that's temporary. I suppose it's easy for me to say that I do it hard.
Less than 5 minutes. minutes?
Less than 15 seconds.
Right.
15 seconds.
Yeah.
Right.
Yes.
And I sense a bit of a taboo about it type of thing. But that's one of the ways in which the prostate can be assessed, because if you go in and you find nodules there, then you have to go, mostly the surgeon is going to be sent to a surgeon to have the prostate biopsied. And even in the presence of a normal PSA, because occasionally you might have a normal PSA and the prostate still be normal, not that common in my experience, but it can happen. So benign prostatic hypertrophy leading to lots of change of urinary symptoms in males as they reach middle age or so. And differentiate that from the prostate cancer. Prostate cancer can cause some of the same symptoms, but in this case, it's about abnormal cells within the prostate, which, if left untreated, will eventually cause the cancer to spread outside of the prostate, be it in the surrounding areas or in distant areas.
All right. Prostate cancer, is it more common in Negro people, black people, than other races?
I don't have that information offhand. I think so, but I don't want to
because I was doing some reading on one of those health sites, and they didn't make mention of that, like the rates of prostate cancer
in black people
are higher in black men than those of other races.
Yes, I think I read it. Yeah.
They also said that black men are also diagnosed earlier with the prostate issue than other races.
Yeah. What I can tell you is for colon cancer, that's definitely the case. As a matter of fact, in the black population, they lower the age, they lower the point of first testing for colon cancer to 45, and it used to be 50, and now it's for everyone, it's 45. But in black people, from so many years ago, it was reduced to 45.
Right.
Yeah, and that's assuming that you don't have a family history of colon cancer.
Okay. So we can definitely go into that now. The colon, because it's one of the common ones as well. When you're getting there, so we understand the functions of the colon. Where the food from the stomach. All of that. Let's talk about colorectal cancer. What happens in there? How does it happen? How do you diagnose, treat, and all of that?
Okay, colorectal cancer is one of those cancers. Much in some ways like cervical cancer, like they equate it to cervical cancer. If you check first, what happens is, first of all, a small area in the colon, perhaps often the size of like a pea, and you get like a little bunched up tissue like a pea. This is quite benign, absolutely no problem. But if that area starts to multiply over the years and it gets bigger, it can get to like a plum, and then it can get even bigger. The bigger it gets, the longer it's there, the more likely these cells are going to start to become not just be turning over faster, but start to become malignant.
Right.
Now, if you're checked from early with a lesion, a polyp, as it's called, a small polyp, and that's removed 9.9 times out of 10, no problem.
Right.
Leave that for a few years, and you could find yourself with that polyp can become cancerous. So there's a possibility that if you're checked, if you're doing the right things, you can avoid that. Now, not everyone in the population is going to be able to have access to a colonoscopy because it's a labor-intensive procedure. But what you, when I say they'll be tested, because the number of people that you require to do the tests and the availability of the necessary skill set, what everyone needs to do at a population level is from the time they get 45, as part of their annual assessment, when you go to the doctor every year, they're checking the blood pressure, they're checking the blood sugar, they're checking the fat levels, they're checking the hemoglobin. I mentioned sugar, they're checking for diabetes.
Diabetes. Mm-hmm.
Similarly, as part of that, you check your stool. 2 stool samples also on 2 different days using a particular test called the FIT test, fecal immunoglobulin test.
Mm-hmm.
That if you have traces of blood there and that's picked up as positive, then definitely you need to go ahead and be having a colonoscopy. Of course, that blood can be coming from any part of the GI tract. It doesn't have to be the colon. It could be from the stomach.
Mm-hmm.
But your story will be listened to. Decisions will be made whether you need to have the stomach and colon check or just your colon, etc. So that way you can limit if you go in and if your fecal immunoglobulin test is positive. And quite often people will have very early cancer. This can be resected.
Yeah.
And colon cancer, by and large, in many instances, when people have colon cancer and it's caught early, that part of the colon is resected and people do well.
Right.
They do well. So, and from the time the cells become cancerous, they will often tend to be oozing blood a bit. The cells become necrotic or die.
Mm-hmm.
Those cells that are turned over rapidly, they outstrip the blood supply and they become necrotic and they die, and you get traces of blood. When you get that traces, if you see that from a stool sample, you know you have to go in and have a colonoscopy done. And so the first thing is to do your annual checks for fecal immunoglobulin test for your what is called hidden blood.
Right.
Or if you see blood, but there's many other signs you look for. If you see blood, now hemorrhoids are common. Hemorrhoids are not life-threatening. Just dilated vessels in and around the anorectal area. Mm-hmm. However, here's what happens. People will have hemorrhoids, and they might bleed intermittently, occasionally, and say, this is my hemorrhoids I had from when I was in my 30s. You might be right, but you don't know.
You don't know.
Until I don't feel comfortable about telling anyone. I say yes. I go in, and if I say you go and I check the rectum and I see hemorrhoids there and the anal area and I see hemorrhoids, I say yes, but I don't know what's happening. So have you screen for your colon, and if they don't see nothing is seen higher up, you can assume that bleeding was probably coming from the hemorrhoid, and the hemorrhoid is not going to kill you. Mm-hmm. But every year almost I see sometimes more than one person who been told to have hemorrhoids, or who assume that it's the hemorrhoids that's bleeding. And yes, the hemorrhoids might be bleeding, but they're having bleeding from other causes. Yeah. Right? Mm-hmm. Now, the other features for cancer of the colon, that if you have a change in your bowel habits, I find that one to be a very important one. Mm-hmm. There's some people who have picture-perfect bowel motions. They get up and like clockwork, they take a cup of tea. Mm-hmm. But that's a small percentage of people. But even if you're not in that category, and you find yourself often having a change in how you're going off, as they say, then you need to take a check of that. And especially if it's associated with even slight grumbling, intermittent grumbling pains. So, where this belly pain coming from? Everybody gets a bit of abdominal pain from time to time.
Yes.
But if you now see a month go by, 2 months go by, and you're still finding this abdominal pain, especially in a localized area, say, let me go and get that checked.
Have it checked.
Right? And if you go and get it checked and you have a colonoscopy and they pick up something at that stage, the chances are you're going to be all right. If you wait with that and that grumble on for a year or sometimes longer than that, by that time you can start to get obstruction. And you don't want to wait till you get to that stage, because when you reach that stage, the cancer's probably gone through the wall of the gut already. When it goes through the wall of the gut, it's going to go to the lymph nodes, and once it goes to the lymph nodes, it's going to be easier for it to be spread into the liver, etc. So you're moving early, and you change in bowel habits. Sometimes some people will tell you they go to the toilet, and all of a sudden I know I'm going to the washroom, and then half hour later, I need to go back a second time again. That is often with cancers on the left side. The cancers on the right side are particularly dangerous in the sense that they don't come up, they don't present until later, because the right side of the colon is larger. And the tumor mass has to get to a bigger point before it
you can actually,
Whereas on the left side, it will obstruct, especially in the left side, in the area on the left side, in the left groin, above the left groin area. The colon forms like a sigmoid loop, an S loop. And you can imagine if you get an obstruction in any part of that, the feces moving through is going to cause you sometimes discomfort, and you'll be picked up earlier. But on the right side, much later, that you'll be picked up.
Right.
If you're doing fecal immunoglobulin tests every year, then you would tend to pick it up if a tumor was there and it's starting to slough off and bleed. So those are some of the features, a whole list of other features, but you want to get in early from the time that it's changing bowel habit, changing stool size. Some people might notice as well. It becomes thinner, more pencil-like, and blood. As I mentioned before, those are, of course, you as you move on, then you will move to the point where you get loss of appetite and weight loss, etc. And these are features you want to get in before these features. If you don't get alarmed, you still can probably do pretty well once you don't leave it to the very, very late stages.
You mentioned, Doc, so of course, people should check and everything like that, and you mentioned the term colonoscopy. What's the colonoscopy?
A colonoscopy basically is an investigation where you pass an endoscope, we call a colonoscope, which is a fiber optic slim tube, flexible tube, and the first thing you do is you have to get the person properly washed out. You cannot do any GI investigation if there's material in the alimentary tract. If you're doing an upper test, you've got to be fasting. So you have to be off anything for a few hours. And if it's in the lower tract, you have to be carried through a specific preparation to have it washed out. I tell people, we do a colon cleanse first. Because when you go in there, I don't want to see much feces, because the more feces the more bits of feces that are around, the more likely it is that I may miss something. Because it could be clouded by the fecal matter. So you want to go in there and see literally a clean, you see little bits of fluid which you can suction away. So you have to have the person prepared, thoroughly cleansed, and that's a procedure that they do over the 12 to it works out that late. For in terms of the preparation, I usually start the day before they come to have the test. When you come to have the test, then you're given some mild sedation and also some mild painkillers. So you can opt sometimes to have it done as it is done in UK, Canada, USA quite often, where you give a heavy sedation and you feel absolutely nothing.
Right. Mm-hmm.
With the lighter sedation, most times you will feel minor discomfort and titrate the medication to keep you comfortable. But sometimes, and a small percentage of people, they will still get some more discomfort. So, ideally, if you could have the heavier sedation, that is thing. But of course, some people will say to you, "Doc, I don't mind. I don't want to be heavy sedated." Other people will say, "I don't want to feel a single thing." So the option is yours.
Right,
often,
to decide.
right?
Mm-hmm.
Right. So you go in and you have the fiber optic instrument. So you're seeing on the screen, let's say here, you're seeing the entire insides of the colon. You go right around. And having reached the area of the right side where the cecum is, you identify, you make sure you're there, and then you're coming back out is when you start to examine all the folds, and you have to be careful to look around all the folds, and you will pick up certainly any lesions of any significance. Tiny lesions could hide still behind a flap, but you try your best to avoid that happening. If you see an abnormality, if you see an area that looks suspicious, you take a bit of the tissue. That doesn't pain. You just take a bit of the tissue with biopsy faucets, as they're called, that's sent off to the lab to be analyzed. If you see a polyp, now that polyp is removed. This is the important thing. Right, because in removing the polyp, you're acting to remove the area that will eventually come back to you can go on to cause the cancer. Yeah.
Wonderful indeed. So all of that, once you get the patient ready, you have that instrument there.
Right. Now they're prepared before they come. They come. They are then sedated mildly or more heavily. You go in, you pass the scope right around. You look around. If there's nothing there, you come back out. You give me great news. You go on that screen. If there's something there, you biopsy. If there are polyps there, you remove them. And when you're removing the polyps, you don't get pain.
Right.
You do not get any pain from removing.
So the polyps are they removed with the
snares, with special snares. Yeah, there are different types of snares we can use in different settings for different sizes of polyps, and you just snare it off. But person doesn't get pain from that.
Okay.
The discomfort will come from moving the scope along, because at times you can be stretched the colon. Some colons are very easy to get around. Other colons can be be tougher.
Yes. Okay, lovely indeed. What about the intestines now, the small intestines? What are the chances of someone having cancer in that area?
Good question. Fortunately, we don't see a lot of it, but it's an area that is the investigations for that are much more difficult to be. I don't do those here, but there are instruments that allow you to move further along, and you can actually get sometimes a capsule. You can take a capsule, and you can the capsule has a camera in it, and you swallow it, and you hooked up the apparatus, and it moves all along inside the small intestine to see if they see any ulcerations, any tumor changes. So you can get problems in there, especially you will get it with certain types of inflammatory bowel disease. And some of these bowel diseases actually make you prone to cancers. Right. Inflammatory bowel diseases like ulcerative colitis, there will be a few people who unfortunately will have that. Usually that affects the colon. Something called Crohn's. Crohn's can affect any part of the GI tract and cause inflammation. And in those type of settings is when you want to have a better idea of what, from Crohn's point of view, what's happening in the small intestine as well. And the other conditions that you can get in the small, you can get abnormal blood vessels in the small intestine and little pouches and things like that in the small intestine. Fortunately, much more uncommon. Yeah.
Right. Okay. Lovely. So, Doc, let's take a short break. When we come back, we can look briefly at maybe two of the other cancers. We'd also look at treating it and people living with cancer, and then we can open our telephone lines, take some calls before we end tonight's program. So we take a short break, folks. Stay with us. We'll be back with you in just a moment.
Are you looking for a reliable, affordable, and customer-friendly pharmacy? Look no further than Hills and Valley Pharmacy, the nation's leading healthcare products and services provider. We are committed to serving you at convenient locations. Find an extensive and affordable selection of prescription and over-the-counter drugs and medical supplies at Church Street, Hillsborough, Carriacou, Jubilee Street, Grenville, St. Andrew, near the bus terminal, and Halifax and Grenville Street, St. George. Our committed team is always available to offer valuable assistance for managing your health and wellness. Discover the additional benefits of our wholesale distribution on Halifax Street and our Medcare Center on Grenville Street, where we provide in-house physiotherapy, massage therapy, doctor consultations, and eye care services. Our commitment is to satisfy all your healthcare needs, including competitive prices, loyalty rewards, and special discounts for seniors. Contact us at 435-6904 and WhatsApp 535-4734. Choose Hills and Valley Pharmacy. Remember, your health is our business.
Welcome to the live Super 6 draw presentation for this evening, Tuesday, the 11th of February, 2025. I am your hostess, Kijan Smith. Super 6 is a multi-jurisdictional game owned by Winlord Inc. and is played within the islands of St. Vincent and the Grenadines, Dominica, Grenada, and St. Lucia. Tonight's jackpot is valued at $210,000. We'll now get ready to select your free ticket letter. Good luck. Please stay tuned. We'll be right back with tonight's winning numbers.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Now you love Super 6 even more. With more money,
the jackpot galore.
Play more.
Win more. Have more fun.
With more jackpot money,
Super 6 is my number one.
With the new and improved Super 6 team, the jackpot keep growing and growing.
And growing.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game. Super 6, bigger jackpots, more chances to win.
Great news about Super 6. You can play Super 6 combo bets to increase your chances at winning the Super 6 jackpot. Here's how. The combo 5 betting option costs $69. Players have a choice of any 5 numbers, and if you match 5 of the 6 numbers, you win the jackpot. Maybe you prefer combo 7, costing $21. With a choice of 7 numbers, and if you match any 6 numbers out of the 7 numbers, you win the jackpot. How about combo 8? This option costs $84. Players select 8 numbers, and if you match any 6 numbers out of the 8 numbers, you win the jackpot. All numbers chosen should be from a range of 1 to 28. Play combo bets. Remember, with Super 6, there are bigger jackpots and more chances to win.
Welcome back. Get ready for your Super 6 winning numbers. Good luck. The first number is 8. To recap, your Super 6 winning numbers are 8, 6, 1, 14, 9, 27. Your free ticket letter is G. Tonight's winning numbers were drawn under the supervision of an auditor from BDO. Please contact your relevant Central Lottery office for further information on the payment of prizes. Thank you all for playing responsibly, and remember, with Super 6 there are bigger jackpots and more chances to win. Our next Super 6 draw takes place on Friday, the 14th of February 2025. Until then, have yourself a wonderful evening.
Welcome back, everyone. It's Dr. on Call, and of course, in case you joined us late, our guest this evening, Dr. Bert Brathwaite, and we're looking at cancer, some of the common cancers in men. As we said earlier, February is Cancer Awareness Month, and of course, we are going to do our part in helping to further raise the awareness of cancers. And tonight we focused on, when we spoke quite a bit on prostate earlier, we just spoke a bit on colorectal cancer, colon cancer, and things that you need to do. And of course, Doc said earlier, one of the best ways is prevention, by ensuring that you avoid the risks that can actually lead to that. So you eat properly, if possible, avoid alcohol, smoking, be active, all of these things. Of course, if you are genetically exposed, then you need to do regular screening just to make sure that you're safe and that all is well. But of course, very, very important, if you are exposed, or if you want to do your screening, and if it's picked up early, then of course you do have an excellent chance of probably getting rid of it altogether, or being able to deal with it early so that you can continue to live a normal life. All right, because I'm sure we all can agree that medicine has advanced significantly, and there's so much more that is available for us today when it comes to medical treatment for some of these conditions. So Doc, maybe we can move now, or before we move on to talk a little bit about lung cancer, is there anything else you needed to add or on what we spoke of thus far?
Just a comment on what you said there. In terms, if you have, even if you don't have a family history of any of these cancers that we have mentioned about, that it's the ones that you get related to gene lines, you still check, right? And I think the point you made about advancing technology is important. There's been such dramatic changes, so many dramatic changes in medicine, and that it is almost mind blowing. And to keep up to date with everything that is going on in the field, it's quite a task, right? Even when you narrow it down to the specific small areas. So people need to have unfortunately, I understand why sometimes people may not have as much confidence as one would like in medicine as it is sometimes practiced. But people just have to still search for good care points, and when they're linked up with those points, then move on ahead. You know, there are many good practitioners in and around, and many good services that people can avail themselves of, and just be discriminating and know where to go for your care, etc. And then move on, and I suppose it's part of it. It's easy for me to say. My philosophy about these things, but I know it's obviously much tougher for some people. But the prevention
it's
by
critical.
doing the right things, and then and just give yourself the same way that we jump on a plane and we go up and we look for a new wardrobe, male or female. The same way we do that. Treat your body too.
Right, definitely. So let's move on. Another common cancer in men, lung cancer. And of course it can be fatal in many instances. So, Doc, lung cancer, let's briefly talk about some of the causes and maybe some of the symptoms. When you probably need to check a doctor, what is it what is it may cause you to maybe start thinking, boy, I'm not liking the way I'm feeling in my chest, or maybe I have this cough that's been going on for a long time, nothing coming up, but the cough is just there. Let's spend a little time on that.
It's interesting that you mentioned that, because I'm looking at some statistics here for back in the year 2023, and for main cancer, the prostate, obviously just with men, those numbers were by far the highest of any cancers at all. Breast in female, just the one person in male, one male, colon, a few, pancreas, less amount. That when you got down to lung, the numbers were as high as basically with colon, right? So, and this is something we must be aware of, and the biggest risk factor there is smoking. As I said, irrespective of what you're smoking. And those people who work in industries that have potentially toxic fumes, they should be always be in a position or not only work in industries, if they use chemicals on a consistent basis, especially on a consistent basis, that a potential read the label. Something that we don't do, Godfrey, I don't think very often. People ignore the instructions. They may read them, but they will ignore them. I said, listen, if I bring someone by me to spray for pests, so something like that, I want to know that they have gone and they have read the instructions on that, and that they are making sure that they protect themselves according to what was recommended. So and this is especially important if it is your job, because you're exposed to that particular chemical on a consistent basis. So those are some of the things that people need to do. Some of the lung cancers, I suspect many of the lung cancers are just popping up, and for reasons that we don't really know yet. Right, why they're popping up, because smoking has decreased, and I wasn't seeing many cancers, but I worked in the hospital setting. As I'm seeing here, of course, population has grown and things like that. But it's a worrying concern, and something that I'm sure the health authorities are keeping an eye on, and trying to probably share in look around the region and see what is happening elsewhere. So it's a guide for, because other than the smoking and those people who are exposed to some fume, etc., there are any other strong risk factors that you can think of, at least to the same extent as you would think of alcohol causing cancer of the esophagus, causing cirrhosis, and then liver cancer. These are well-known and things. So, marijuana, however, I have a big question mark about that in terms of its potential role in it, because we know there are carcinogenic agents in it, and we know that lots more people at younger ages are smoking it, and it's glorified in some circles. I don't tell people if they want to go and relax away from people, and that's your right. But
Right. So in my reading, they were saying that some of the symptoms that come along with lung cancer, persistent cough, coughing of blood, hoarseness, and shortness of breath. The
shortness of breath, what we call hemoptysis, coughing up blood, chest pain. Obviously, you move on to a point where you can start to lose weight and feel weak. But that's cough. Even a non-productive, persistent cough needs to be investigated. And the first thing one would do is a basic chest X-ray. But the chest X-ray is not going to be all conclusive, and you would want to go on to do, we don't have those facilities here, bronchoscopy often. They use the same type of instrument that you use in the colonoscope, but this time you're going down the trachea, and looking around in that critical area there. CT scans, however, we do have, and those will pick up lesions quite readily, the possible lesions here.
Right, of course. And there's something about the cancer and the soft tissue organs. So, for example, like the lung and liver and pancreas, and so. And it is believed that the cancers are harder to deal with, or more difficult to deal with, when they affect the soft tissue organs.
As against which organs?
So in terms of treatment, let's say compared to let's say breast cancer in women, and compare that to lung cancer, you can, let's say in case of breast cancer, you could probably remove one of the breasts.
Right, yeah,
can you?
Right. And in terms of colon cancer, you can remove the segment in the colon.
Yeah,
So you remove the actual mass. But in the case of lung cancer, if it's just a small segment, they may go in and do some surgical work. But yes, it's clear it's going to be more technical than doing a removal of breast or removal of a segment of, and you can live quite comfortably without half your colon.
Right.
Okay. Of course, from a psychological point of view, with a mastectomy, there are issues there. But other than that, again, it doesn't affect your well-being per se, other than your mental well-being, which I guess many folk get used to. Lung cancer, however, yes, it can be more difficult, and the tissues are dense and packed there, and they're very vascular, etc. But what I can say to you is that for the folk who can access care outside of the island. There is some good work going on, and I know of some folk who've suffered with cancer, who are suffering with cancer really long, and have done very well on treatment. Because they're now looking at the particular type of tumor. You can go in with specific agents based on what you're seeing, that the pattern of behavior of that tumor, the nature of the tumor. So it's not just about cancer of the lung per se in a broad sense. You had the histological types before, but now you have even more specific markers, and for particular cancer behaving a particular way, producing particular type of lines of proteins, you can go in and you immunomodulators and clamp them down to a large extent. So the prognosis for some that can be much better than it was, let's say, 15 years ago or so. Yeah.
Okay. Doc, can you do a blood test, for example, and detect whether there is cancer some part of your body?
Yeah, there are blood tests. There are blood tests that you can do that will give you specific ideas. If you what we call cancer markers.
Right.
Many of these cancer markers may cover more than one type of cancer in different organs.
Right.
But some will tend to be more specific. Like, for instance, with the colon, we do one called carcinoembryonic antigen, CEA. And if you see that very elevated, we really search carefully to make sure you don't have a colon cancer. But there are other things that can raise it as well. Yeah, so you do your cancer markers to see if you, as a guide, they're not diagnostic.
Right.
And you may see slight elevations of some of these markers and find nothing in the organ. Right, but these tests can are available locally. Available locally as well. Yeah.
Okay, so that is one possibility when you're doing your screening.
For your screening. Yeah. Unfortunately, many of them are on the high side of the cost of blood tests. They're not like your simple fasting blood, your hemoglobin A1C or your kidney function test or liver function test. The materials, I'm sure, that the lab had to acquire for these tests are much more expensive, and therefore that cost is passed on to the consumer, unfortunately. But there are tests that are available. Yeah.
Right. Okay. Yes, indeed. And of course, maybe finally, just briefly, skin cancer. And it is said that men are more likely to die of melanoma than women at any age.
I know that, but really and truly, skin cancer, I say skin lesion, I say it's straight to dermatologist.
Yes, right, okay.
I have not been involved in the care of many patients with skin cancer.
Okay.
All the other internal organ cancers, to some extent, have been, and especially obviously in the gastrointestinal tract, but not skin cancer. Yeah.
Right. So as you, I mean,
and in all populations, I have not checked with our doctors here who are dermatologists, but I don't think it is as common. I don't think that is as common as you would get in North America and in Europe, etc. These folk actually they check specifically. They go around and check every spot on the body for the possibility of melanomas, etc.
Right.
But we I'm sure we have them here, but probably far fewer, I would suspect.
You mentioned something earlier, and thought just came to me. In your practice, your many years of practice, have you come across, or what percentage? How would you rate it in terms of people who you've come across with cancers in the gastric region?
Okay, what I can tell you is.
And when I say that, I mean, well, of course, the maybe the esophagus, the stomach, intestinal.
There's been a dramatic shift. Mm-hmm. When I was a youngster working as an intern, I remember coming across quite a few patients who died because cancer of the esophagus is one of the more difficult cancers to treat.
Right.
Cancer of the esophagus was one of the most common cancers. And the two reasons for that a lot of people got that were the harsh rums that they were drinking. Almost inevitably, they were either drinkers, smokers, or a combination of. And often in the 50s, 60s, and the cancer of the esophagus. No, cancer of the esophagus is still present, but cancer of the colon exceeds cancer of the esophagus. And of course, there's some cancers, the esophagus that are more associated with perhaps acid coming back up the swallow pipe, or the esophagus, swallow pipe, esophagus, same thing, than with things like the alcohol per se. So now we still see stomach cancers, and we see colon cancers. The stomach cancers, where the bacteria, there's a bacteria, H. pylori, which if you have it present, you need to have it treated because it will predispose you to an ulcer. And most times, you treat the bacteria with antibiotics, and once a person takes it for a course of antibiotics, it's eradicated. Sometimes it can be very difficult to treat, but occasionally, if you don't treat it in a small percentage of people, and I stress a small percentage of people because I don't want to alarm folk, a very small percentage of people, they say H. pylori can induce cancer changes in the stomach. But that's a very small percentage given the number of people who are H. pylori positive. But it is something we are conscious of, and therefore we seek to eradicate the H. pylori from the stomach.
Right, wonderful indeed. So, Doc, our telephone lines, folks, is open. If you have any questions you'd like to ask, the number is 435-2041 because we're getting close to wrap-up time. The number again, 435-2041. If you have any questions you'd like to ask, you can do so now. Just to give you the number again, 435-2041. That's the number you can call if you have any questions or if there's any contribution you'd like to make to the program. So, Doc, while we wait on the call, if we have any, just to sort of summarize our discussion on the issue of some of the common cancers in men. We mentioned the prostate and, of course, the colorectal. Maybe you can just do a brief summary of these two again.
The prostate being the most common cause of cancer in the men, and from what I've seen here, statistics for 1 year as well here on the island, by far and away the most common. So the necessity and the stress, and I will keep stressing, you can't decide whether you're having cancer. You shouldn't be waiting for some change in your urinary symptoms. Go in and have your blood test and have your annual digital rectal, at least at minimum have a blood test.
Right.
So that's for colon cancer, the necessity to screen and to be screened. If you have a family history, we haven't talked about that. If you have a family history, you have a relative who under 50, and there are some families here. There are families that we've come across, and you see, my uncle had cancer, the colon, at age 50, and I'm now 40s, in my 40s, I'm going over to cancer. So all the people in that family need to be screened.
Right.
And they may be screened at an earlier age than you would not screen the general population. Right, so there are definite families with genes that make them predisposed. 25% of the cancers of the colon, roughly, are going to be due to either straight hereditary causes or a familial tendency to things. So, yeah.
Right. Let's take a call. We have a caller on the line. Dr. Call, good evening.
Good evening. Yes, Mr. G. I'm sorry, I'll get away from the radio. You and the doctor have a great show again, and I'd like to ask the doctor what are the most common foods you can use to prevent cancer of all kinds. Thank you.
Thank you very much, caller. Yes, so Doc is asking what are some of the common foods you can use to help reduce the risk of cancer.
We alluded to that briefly when we talked about what we grow here locally.
Right. Mm-hmm.
All our ground provision. Okay, let me flip a bit and look at it the other way. What to avoid? Mm-hmm. Your meats, your red meats. I didn't mention that. Those are thought to be, people who have a high diet with the red meats, they're going to be more prone to colon cancer. But on the other hand, if you're taking lots of fruits and your vegetables and here your local, I tell people take your choice. Mm-hmm. Take your choice of the ground provisions, your nuts and all of these things. Mm-hmm. And you have those in just appropriate quantities. Mm-hmm. You're on stream. Stay away from the processed foods. I know the problem that we face, Godfrey, is that it is cheaper to go for people to go cost, and get that. And I understand it. Cost is a factor. And that is why one of the things that needs to happen is that our production or level for food stuff. And it worries me because sometimes you cannot go to the supermarket and see some basic either ground provisions or even bananas sometimes that you used to have trucks laying up just a few decades ago.
Doc, maybe Prime Minister Dickon needs to put some tariffs on some of the imported foods that we
but providing that we are going to get out there and go and produce them.
Well, that's the whole point. I think,
if we're going to produce it in the quantities that is, because yam, for instance, much of the yam that we get here comes in from St. Vincent.
Right. Yeah. No, it's true. But maybe if he does decide, you know what, I'm going to put a 25% tariff on some of the processed foods, then we might be forced to use our local foods. And if we start using our local foods in high quantities, it might spur production, which would in turn bring the cost down. So it might be a good thing.
Yeah, but whatever it is, it is a critical part, as far as I'm concerned, of our health future in the country is to make sure that the lines of production in the agricultural industry
increases,
get to somehow or subsidize, whether it means subsidizing farmers, because at the end of the day it pays off, because when you have a person who has a lung cancer, you got to send them abroad for care, or even a colon cancer that has spread, and you have to get oncology care. You know the costs to the individual,
it does,
and sometimes to the state if the individual can afford it. So I think we are blessed with Mother Nature has blessed us so far. I mean, yes, we have climate change issues to deal with, etc. But we have taken it for granted. So in answer to your callers, use your local food.
So someone on our Facebook page is agreeing. They said, agree with putting tariffs on imported processed foods. Yes, indeed.
I see you in the tariff mood.
But I don't know. I mean, there's some things that might be worth considering. I mean, if it's because if we can reduce the burden on our health sector in terms of the amount that we have to remove from that helpers, that can go to help developing our agricultural sector. Which means that we'll have a healthier nation, So maybe there's some things.
As you talk about a healthier nation, let me say something on this point. One of the things that you find is a person will leave school 5'9", probably 160 pounds, and you see that person 8 years later, 220 pounds. Mm-hmm. That transition from school life to there's obesity in the school, at school level too. But from in those few years of life, people have not practiced enough. They have not programmed enough physical activity. Come home and go and plant. Go in the garden. Go in the garden 4 afternoons a week.
We have to go.
An hour in the garden 4 afternoons a week. I forgot to mention that. You're producing your stuff. You're reducing your home wage bill, and you're keeping yourself fit.
Well, I'll tell you what. Maybe, Doc, when you're able to buy a nice vehicle and drive wherever you want to go, and after work you can go home, maybe sit on your couch or lie on your couch and put in your flat screen TV, and it's called development.
Well, there's a price to pay. There's a price to pay.
There is a price to pay, and an expensive price as well.
And not only that, what is also important is that we need to get the youth out there much more physical, active, the school children, not just to be behind these instruments. Right? So you get them out there. They're in the garden with you, helping you do a few things for a few minutes, learn a bit more about the land that they live in. Basically.
There are some changes we need to make, and see how we can improve the way we live. Let's take a final call, and then we're going to wrap for this evening. Doctor and call. Good evening.
Doctor, Godfrey. Mr. Brathwaite, I remember you very well. But looks, your movements, I will ask where you want them and do. Where was in is Cooper Hill? In the bottom down there where they had a business on it. I came and do a coolant test. And I'm living with Godfrey, know that. So I thank you very well. And I'm thanking the Lord to have me at this kind of stage. I'm doing fine anyway. Cooking good, so to speak.
Okay, caller, thank you very much indeed. Thanks a lot. Yes. Mm-hmm.
Thank you, caller. I didn't get all what you said, but
he was.
I said thanks, and
it's breaking up a little bit. Well, Doc, that's all the time we have. I'm really happy that you were able to accept our invitation on short notice. To be here tonight to chat with us. I think we were able to share quite a lot of great information regarding prostate, of course, colon cancer, and you realize, folks, that there are things that can be done. Aside from prevention, we have the methods that can be used to diagnose and to treat and all of that. So I want to just advise folks to do their screening early and protect yourself. Doc, any parting words?
Just try to make your lifestyle as healthy as possible. It's something enjoyable if you can be in pretty good shape and physically, it affects your whole mental status. So, in this day and age with so much stress and of course there's a lot of pressure, on younger folk in your workplace and whatnot. But take that 40 minutes 4 times a week and give it to yourself to do something physical, and you get it the next morning. At first it might be a bit tough, but after a few
your body adjusts, and you feel great,
and you feel much better.
A lot of times you end up wanting to do more.
That's right. As I said, there are lots of people I believe have a little plot of land around their house. Go to plant, do a little kitchen garden, and have some produce for the house.
Do something.
Join a group, and whatever you do, it doesn't matter.
But do something.
Do something.
Yes.
And eat right.
Yes, definitely. Thank you very much, Dr. Brathwaite. It was a pleasure indeed. We look forward to having you back again not too long from now. Thank you, folks, for staying with us. It was a pleasure. I hope at least you can take one thing from the program and apply it to yourself so you can improve your wellness. Don't forget, you can join me tomorrow 8:30 for Kaiso Talk. All right, we have Pink Panther and Luther joining us. This one is going to be exciting. Until tomorrow, please God, do enjoy the rest of the evening. Have a good night. All the best.
Thank you.